One of the nice things about today's communication is that we can talk to each other as clinicians and do. So, I carry a pager every day and I talk to people from other centers on a daily basis about patients that they want advice on. So I think there's a network of people across the country that are open to be talked to and to communicate care with, and some families actually are, we consent them to share the full medical record with us so we can really be informed and can talk to the clinician really directly and try to help. In terms of understanding medications, of course we can work across the age span. I think an adult clinical practice waiting room is a very poor place to put a 7 or 8-year-old. So I think it matters a great deal about where a person's being cared for. In terms of training and thinking about managing a patient in the whole sense, as a pediatric healthcare provider, we are taught to think about the impact of therapies on the developing immune system, on vaccination strategies, on growth, on a variety of hormonal changes at puberty, things that my adult colleagues don't have to think about. So I think we each bring expertise that's relevant to the ages of our patients, but there are many places where neuromyelitis optica patients have to be cared for by the best expert in the area, and that person may be an adult neurologist. That's part of pediatrics, and so I think that's a core facet of care. I would argue, frankly, that's true in adult care as well, but maybe not as emphasized. People have partners, parents, friends, other care providers in their lives also, and managing an adult and their care team is important. The difference is, of course, the surrogate decision makers. So in my patient population, the parents, certainly until late adolescence, are the primary decision makers, and that's the facet that's very different. I would say that talking to the parent about the diagnosis and talking to the child sometimes is using two different terms of phrase, two different styles of communication. It's really important to make sure that the child knows what's going on in the best possible way for them to comprehend it, depending on how old they are. And I think it's also important as teenagers to make sure they have their own time with you as a clinician so that they can ask questions that they may not ask in front of their parents, and to remind parents that it isn't their illness. And therefore, while you want the parents on board to help clearly, it's also important that the child have some autonomy in this process. And so that balance takes it just takes experience in dealing with families and really takes time. I think the conversations take longer. I think there's a couple parts to that. First of all, I think knowing that you're not alone is helpful in almost every medical situation. Nobody ever wants to hear, "I have never seen this before," or "You're the only person I know with." Those are not comforting phrases. So I think that having a foundation that really understands the diagnosis and facilitates communication is phenomenally helpful. I remind most of the parents that this, again, isn't their story, and if they're going to share it, they need permission from their child. And not every child wants their story being communicated to other families. And that gets lost sometimes. I think parents sometimes in their need to reach out, communicate, share, gain comfort, forget that they're actually telling somebody else's story. And I have had lots of teenagers in particular, not so much the younger kids at this point, but teenagers say, "I don't want my parents sitting in a room talking about the time that I couldn't walk, or the time that I couldn't go to the bathroom normally, or the time when I was hiccuping and vomiting and had all these other horrible symptoms." So I think when the child and parent are aligned, that's a way to cope as a family, it's great. And it's wonderfully empowering, and I think it works really well. But there are definitely times when the teenager might not be ready for that. And it's important that that dialogue happens so that the child doesn't feel like their privacy is being encroached upon. But I think the teenagers talking to other teenagers, if they will talk at all, because teenagers don't always want to do that either. But when they do, I think they feel stronger afterwards. I think this is the same conversation that you would have with the adults. The increasingly powerful and more targeted immune therapies are going to be helpful. I think we have every confidence to believe that to be the case. I think that the use of these therapies and the ability to use them for long term is pivotal, because this isn't a disease that goes away. And so then understanding how to use these medications in the long run and how to safely steward people on these medications is something we're all learning together. There really isn't an age, there's no magical age 18 difference. So I think that's a journey we're all taking as clinicians together.